Dear students, this is Dr. Pooja Thakkar from Inside Biology. We are in the second session of reproductive health. In the last session, we have discussed regarding various factors which are affecting the reproductive health of a female, as well as it is also infecting or affecting a fetal life too. In this particular session, we need to discuss regarding population explosion as well as various birth control methods. The population is basically defined as the whole number of people inhabiting in a region or a country. During the last 30 years, the population of India increased multifold, and it is the fastest rise in the history of population statistics. India's population hit 1 billion in May 2000, and then it became the second most populous country in the world. There is a significant drop in the death rate due to nowadays utilizable modern health as well as medical facilities, and it has also reduced to become 15% per thousand. But there is no significant reduction in the birth rate. Currently, the population in India continues to increase at an alarming rate. So when there is a drastic growth of population beyond normal limits, it is termed as population explosion. Usually, developing as well as underdeveloping nations face the problem of population explosion. Now, there are many causes which are basically creating population explosion. There are three major causes. The first one is there is an increased birth rate and decreased death rate due to the improved medical facilities. The second important cause is there is a decreased infant mortality rate as well as maternal mortality rate, which will be considered as IMR as well as MMR. And the third most important cause is the migration due to better job opportunities, war, and natural disasters. Now, we need to focus on few terminologies here, that is birth rate, death rate, IMR, MMR, and migration. So, birth rate is the ratio between the total number of births to the population of a specified group over a particular period of time. And simultaneously, you can consider death rate as the ratio between the number of total deaths occurring to the total number of individuals in a specified population at a particular time period. IMR, that is infant mortality rate, is the number of death of children under 1 year of age, that is children, per 1000 live births of children for a year in a given region for a particular time period. Okay, now MMR is defined as the annual number of female death per 1 lakh live births due to aggravated pregnancy or its management. And the last terminology is migration, which is defined as the number of people moving in, that is immigration, or out, that is emigration of a country, place, or locality at a particular time period. Now, we need to understand here that India was the first country who have planned the family planning program in 1952 by the Indian government. The program has been launched officially. In India, the government initiated a population control program, that is this family planning program, that involved sterilization, and a lot of controversies were generated at that time due to imposed choices of sterilization on couples, and thus the government had to shut down the sterilization camps. A woman should be provided right to choose the best available choice of contraception. Now, what do you mean by contraception here? Contraception is defined as a method that is employed to stop sperm from fertilizing the egg by keeping them apart, or by stopping egg production, or by inhibiting the fertilized egg from implantation. Now, a woman has a perfect or a right choice to choose the best available contraceptive for herself as per her need. The National Family Planning Program by the Government of India aims to provide women with access of life-saving contraception in order to have good female reproductive health. There should be a proper gap between children. and therefore a good contraception method is very well required. Now, there are many methods which can be considered as contraception methods. The first I'll discuss here is the natural method. The first natural method is periodic absenteeism. This method is also known as fertility awareness. This is the method in which basically a natural family planning method is happen where a woman has complete knowledge about her reproductive window and the birth control is approached based on her menstrual cycle. The changing in the cervical mucus or the changes in the body temperature. But this approach is not at all 100% safe and it will likely to fail, causing the woman to become pregnant. So the second method is coitus interruptus. That is the withdrawal method. The withdrawal of a penis by male from the female vagina. In this particular method, the penis is withdrawn from the vagina just before the ejaculation. The aim of this particular method is to prevent sperm entered into the vagina. This does not provide protection from sexually transmitted infections or diseases that is commonly called STIs. So the third and last natural method will be lactational amenorrhea. This method relies on the normal physiology of women after delivery under the controlled action of hormones. In this particular method, during the period of lactation, the menstrual cycle is absent. Therefore, ovulation does not take place. No ova are available for the fertilization event. Thus, no conception can be take place for the pregnancy to happen. So this is also a natural method which is reliable for 6 months after delivery, but this is also not 100% safe. Now the second approach will be barrier methods, in which you can focus on two different kinds of barrier. One will be considered as physical barrier and the other one will be considered as the chemical barriers. In a way, barrier methods physically stop sperms from entering into the vagina. A condom is an effective, safe as well as easy to use birth control method at an affordable cost. Moreover, it is also useful in preventing the sexually transmitted diseases. Usually, they are made up of plastic or latex. Separate male and female condoms are available in the market. The male condom can be worn on the penis to prevent sperm from entering the vagina, while the female condoms form a typical barrier covering inside of the vagina which catches the pre-ejaculated sperm. So there are basically two kinds of condoms. One will be considered as general condoms or external condoms, and the second group or category is internal condoms. So the condom has two rings. Basically, if we consider the structure, the smallest ring is closed and it is inserted into the vagina, and the large ring remains outside the vagina during intercourse. There are also two kinds of internal condoms. One will be considered as cervical cap and the other is the diaphragm, both of which are placed in the reproductive tract or the vagina, and they are not at all visible from outside. A cervical cap is a small cup-shaped object made from silicone which rests against the cervix so that it can prevent the entry of sperm through cervix towards the uterus. A diaphragm is a piece of dome-shaped silicone material which is inserted into the vagina to cover cervix, which will also serve the same function. So these cervical caps and diaphragm need to be inserted before sex and they are reusable for up to 2 years. These internal condoms are used in conjunction with a spermicide. Cidal action is killing action. So spermicide is basically utilized for the killing of sperms, which will immobilize the sperm, further prevents the entry traveling towards the cervix, through the cervix towards the uterus. The other advantages of female condoms are that they can be used during the breastfeeding period also, as they are not at all posing any kind of side effects. But they are basically difficult to place in the vagina, so the surety is not as much as the male condoms. So male condoms are used more commonly in compared to the female condoms. Now the next process or the barrier which we can say, or the contraception method which can say can say is long acting reversible contraception, that is LARC, long acting reversible contraception. And as the name indicate, it will include the contraceptive methods that last for longer time. So these include intrauterine devices, that is IUDs, and the implant. They provide long acting protection from the pregnancy, so they can also be called fit and forgot contraceptions. Since the best advantage is that the woman does not need to remember it every day or every month. The best advantage associated with LARC is that when a couple wants to plan a baby, it can be taken out of the body. So LARCs are more effective types of contraception, specifically commonly used in India. They are more than 99% effective at preventing pregnancies. So these kinds of IUDs are the devices which are inserted into the uterus. Copper T is the most popular IUD amongst Indian women. There are new generations IUDs too, which contains hormone that are slowly released into the uterus. Usually these contain hormone levonorgestrel. Now, how this particular contraceptive implant is structurally formed and how it is placed. The contraceptive implant is made up of two small rods the size of a matchstick. They are put under the skin on the inside of one of the arm of the female. The injection is used to place the implant under the skin, and special plasters are used to hold the skin together until skin heals. They slowly release a hormone called progesterone, which will stop the body from releasing an egg each month. They also slow down the movement of sperm by thickening of the mucus in the cervix region so that sperm cannot get to an egg. These implants can last up to 3 to 5 years. The next will be considered as hormonal contraceptive. These hormonal contraceptive include pills as well as injections. There are basically two kinds of pills. First will be considered as combined oral contraceptive pill, and the second is progesterone only contraceptive pill. As the name indicates, combined oral contraceptive pills contain two hormones, an estrogen as well as progestin. They work by stopping ovulation, that is the release of an egg, and by inhibiting the movement of sperm. The second kind of pill, which is progestin only pills, that contain just one hormone, that is progestin, which will inhibit the sperm movement by making the cervical mucus super thicker so that sperm cannot approach the egg. They also make a lining of the uterus thinner than the normal so that the uterus is not at all ready for the implantation purpose. Sometimes it also helps in the stopping of ovulation. So these kind of contraceptive pills need to be taken on a daily basis. Usually, if taken regularly, these are more than 99% effective at preventing pregnancy. In the year 1960, Dr. Nitya Anand from Central Drug Research Institute, that is CDRI, which is a very famous institute in Lucknow, found ethamoxy trifetol, that is MER25, as an anti-fertility drug. Now, with certain modification, the non-steroidal preparation of this contraceptive pill containing ormologixan or cancroman is sold by Government of India under the trade name of Saheli, that has an anti-fertility effect in mammals. So Saheli has some side effects like abdominal pain and delayed menses, but that is not that severe. The note important here is under the National Family Planning Program, that is NFPP, Saheli will be marketed as Chaya also. Now the second approach will be hormonal contraceptive injections that need to give every 3 months. It is also more than 99% effective. The only disadvantage is that it poses some kinds of side effects since it interferes with the normal functioning of the hormonal regulation. Such methods are associated with the menstrual irregularity, and they also do not offer any kind of protection against STDs, that is sexually transmitted diseases. Now, the last and the final approach will be permanent methods to control pregnancy. The permanent contraception is also called as sterilization methods. These procedures prevent all future pregnancies, thus, it is 100% effective in birth control. But it is very difficult or impossible, nearly impossible to reverse, as it is unsuitable as in that particular process. The reverse is impossible, that make these unsuitable for the couples who want to have child in future. Now, in male, this particular process is considered as vasectomy, and in female, it is termed as tubectomy. Vasectomy is a process in male in which a cut is made in vas deferens and the cut part is tied. You can see this particular thing in the diagram. In this particular diagram, in the left side, vasectomy has been labeled. In that, vas deferens are tied and cut. So, cut is made in vas deferens and the cut part is tied. The sperm can't get far enough along the tubes to mix with the semen. The vasectomized men still ejaculate and produces semen, but it will not contain the sperms, so that egg cannot be getting fertilized here. The semen becomes sperm free usually 3 months after the operation. In the case of tubectomy, we can see in this particular process, both the fallopian tubes of a woman are closed or blocked so that the sperm can't get to the egg to fertilize it. Several approaches are made to get adopted with the blocking of tubes. You can see that in the diagram in which the fallopian tubes are tied and cut. The fallopian tubes are closed using certain kinds of rings as well as clips or by cutting and tying. So these are varieties of methods which can be utilized for the sterilization. There is another method where two little coils are put up into the fallopian tubes and the tubes become blocked for next few months. A general anesthesia is not at all necessary, but the failure rate of tubal ligation is very rare. So this is all about today's session. In the next session, we'll discuss regarding how people deal with the infertility problems, how the medical termination of pregnancy happens.